hazard. Thank you for joining us, and I'll hand over to the Premier to say a few words.
Let Kerry actually.
Kerry, why don't you? Kerry's done all the work, so Kerry, why don't you give us a rundown on how it all came together?
Nice to be put on the spot. Welcome everybody, lovely to be here today. It's a very special occasion for us. We've been working on this project since 2014, so to actually be here in the building for 1 week as of today, it's a very exciting time for all of us who've been working so hard in the background on this beautiful new hospital. We've been wanting to do something for Goulburn community for a very long time, and I have to say this week when we've been decommissioning the old hospital, we really realised just how important it was to have a new space for the staff and the patients to be cared for in, because it's pretty shabby. So my role has been a project lead, working with the local health district and working with a fine team of health staff as well. Also working very closely with health infrastructure, our builders and planners that have been involved all the way through the project. There's been many ups and downs, but the one goal that kept everybody focused was the fact that this was great for Goulburn and great for our community, and we couldn't have asked for anything lovelier or better. So a very, very big thank you from us to everybody who's made sure that this is a reality for us. And we are very proud today and really pleased to be here. And thank you for all being here as well.
Well, can I say this is incredibly exciting to be here with you today, and I want to thank all the clinical services personnel, all the team here, the construction team, the health infrastructure team who do an amazing job. Construction can be hard. And we know there's been challenges along the way, but that's the case whether you're building a hospital, a school, a road, public transport. But what really matters at the end of the day is the outcome. And to have a tour here and to see the wonderful services that are available here, the great environment, the upbeat staff who know that this investment will make a real difference. And it's a former treasurer. It's interesting it's actually very important for me to come out and see firsthand the difference that the dollars make. And when the health minister comes in, as he seems to do every single year, and argue for large amounts of money, which he gets, to see $165 million, which you can look as a treasurer, as a former treasurer, as simply numbers on a page, and to come out and see that makes a real difference to people's lives. This investment is great for Goulburn. This hospital is great for Goulburn, and I think this new building will make a real difference. I want to thank the local member, Wendy Tuckerman, because when we do go through these budget processes, there's competing needs right across the state. And I want to lead a government that makes sure wherever you live in our great state, you have access to the best healthcare possible. We've seen through COVID significant challenges facing our state, facing our nation and facing countries around the world. But I believe we have the best health system in the country, if not the world, here in our state. That doesn't mean we can't do more. We will always do more, but the substantive investment we made, and I remember with the health minister when COVID began, I said he had an open checkbook, which he took literally, and I think it was $4 billion in about 6 months he'd spent, but importantly, they were investments that kept people safe, that allowed us to open up. And the team here at Goulburn Hospital have been amazing. I said earlier that it's the things that haven't happened, the challenges that haven't come our way, the problems that haven't existed, is because of the great health teams we have right across the state. And that's enabled us to open up safely, and that's important because COVID has dual challenges, both the health and the economic, but the health response has enabled us to open up. And that is important because that's providing these people with a job to provide for their family. And I think the foundation stone of our success here in New South Wales has been because of our great health team. So it's incredibly pleasing to be here. It's an honour and privilege as Premier of the state to be here today to open this clinical services building. I just want to end again by thanking the construction team and particularly the staff here for the amazing work they have done over the last 18 months, particularly during COVID, and what they will do as we continue through. So thanks so much. And now I'm going to pass to the excited Health Minister.
Look, thank you to the Premier. Thanks to Kerry, obviously the lead on getting all this project together. Thank you to Wendy Tuckerman for making sure the community's voice was well and truly heard. Also acknowledge the Mayor as well, because obviously the Council and the local MP worked well together to make sure that the local community, the Goulburn broader community, not just Goulburn, but the region and the towns around Goulburn are all going to see what is an amazing new hospital servicing them. I've been coming to Goulburn for a lot of years. I have actually one of my ex-staff that lived not far from here, and Goulburn is certainly a town that deserved to have a major hospital, and this is $165 million worth of new hospital, and of course some refurbishment also still to happen, but will soon be commenced and will continue through probably next year. Towards the end of next year we should be finished. Can I thank Hanson Juncken, the builders, obviously the architects and the entire team. Also want to thank Rebecca Walk and her local team from Health Infrastructure. I honestly do think Health Infrastructure, and I say this, you know, I just want them to know I think Health Infrastructure is the best infrastructure agency in the government, probably in the country. So I just want to thank you for all the amazing leadership and work that you do. What I do know, talking to staff here in the old hospital, they were very committed, they still are committed, to serving the community as best as possible. But they all knew that with 21st century technology, new facilities would absolutely improve those opportunities. So thank you to the entire health staff here, not only in the hospital but also the community health teams. And I'm absolutely certain that having seen, I started to say inside, the journalists might not have heard me say this, but I was here now a couple of years ago, and Hanson Juncken stuck on me one of those 3D, is it? 3D imaging, what do they call them? Virtual reality. What, virtual reality, thank you. Get with the time. Get with the times, Mr. Premier. Okay, virtual reality. And although it made me a little dizzy, it also made me dizzy with excitement to see what was coming, and to walk in here today even dizzier with excitement. So certainly to see it all come to reality, it is very fine. Can I say thank you to the Premier? Dom Perrottet actually did never say no, which is unusual for a Treasurer, because normally they only know 2 letters of the alphabet, N-O. But whenever I went to him and talked to him about the importance of delivering for local communities, and particularly in his last couple of years with the COVID situation that we faced, he has been very generous, and I'm absolutely delighted to actually have him here today and to see the outcome, because sometimes Treasurers don't get to see the outcome. They only get to see the money disappearing out of the positive side of their accounts. But for him, this actually reinforces again the importance of what he did as Treasurer. So, and hopefully, as Premier, we'll get more money out of the Premier and Treasurer for even more health facilities, Premier, when I come knocking on your door. So thank you very much, everybody. And thanks to the staff. You've been amazing, seriously amazing. I cannot thank you enough. The health team in COVID everywhere, but also just broadly, I love the health team. The health team in this state are amazing, so thank you to all of you. Thanks very much. Thank you. Questions?
Reasonably disturbing evidence for the rural health inquiry yesterday about Walgett Hospital, for instance, not having enough beds, like February staff not available to work. The investment here is great. Is it happening all over the state?
It is happening all over the state, and I actually have spoken to the team and confirmed that there are no bed closures at all planned. So I think the problem with the benefit of having an inquiry is we hear a range of issues from across the state, the positives and the negatives. Although often the negatives outweigh the positives, because the people with concerns tend to come to those inquiries. But I can assure you that the Walgett community will not see any reduction in beds. Absolutely not.
Mr. Minister, I didn't get a chance to ask you previously about the MRI machine. I mean, you said something inside before. Could you offer just a comment about the status of that particular project? Sure.
There's no question in my mind that where we're building new facilities, we should, as far as is possible, always build for the future. And this new facility, $165 million facility, for the Goulburn community, the Goulburn community and the Goulburn broader community, I think would benefit. There's no question we all know it would benefit from an MRI. And so I asked Health Infrastructure to make sure that we could build the facilities that would enable it, because MRIs, magnetic resonance imaging, of course, usually 3 Tesla, have incredible pull in terms of magnetic capacity. So what has to happen is you have to have a Faraday wall effectively built around the area, which stops, if you were walking past, your watch would disappear off your arm otherwise. So what it does, it stops that effect. And of course the federal licence that comes from the federal government. So we've written to the federal government and asked them whether they would consider a licence, and very keen to move on that as soon as possible.
On the
Sorry, yeah. Sorry. 2 seconds, Clinton. Yeah.
There's no response yet from the federal government?
No, nothing positive, but we're still working on them.
And
definitely.
are you looking to partner with a private provider?
Yes, looking at all options at the moment, and I'd rather leave that for a little bit later to say that we will do whatever we can to make sure there are MRI facilities readily available.
On the broader
Clinton.
Omicron concerns that there has been a confirmed case of a student in Sydney, we don't know how this student got the virus. What do you know?
No, look, first of all, I have to say that the positive side is that we're not seeing what we saw earlier in the other variants. We're not seeing people suddenly being rushed to hospital. What we're seeing is people who either are asymptomatic or have very mild symptoms, generally. But of course, this is of concern to the extent that this is the first case that we know of that appears not to have had any travel history. So it would appear to be, at least until there's further investigation, it would appear that the case could well be an on New South Wales soil transmission. There are, I should say, since you've asked, there are 2 other students that we're currently, but Health, I shouldn't say we, Health, are currently investigating. They have had early indications of a dropout S gene, which is an early indication of a possible Omicron, and I'm expecting. Oh yes, sorry, that's yep. And I'm expecting that those results should be back later today, probably late this afternoon or early evening, and we'll know further. So it is a challenge. It's at a particular school in the southwest of Sydney, and the senior students this time of the year, it's convenient, so they've gone home, it's fine, and the others are the ones who we need to are obviously being tested, who are in the cohorts with the relevant students.
And no leads yet as to how it got across to Western Sydney.
No
is that a
idea.
concern that community transmission is out of the bag now?
I think transmission is always a concern, but we also again need to just keep it in perspective at the moment. That worldwide, there's not a clarity around whether or not this particular variant is going to cause us anywhere near the problems that the earlier variants caused us. And what we always aimed to do, right from the outset, was to make sure that we had capacity in our hospitals if there were increasing numbers. You'd probably remember that almost 2 years ago now, we identified that we had more than any other state or territory ICU respirators, ventilators, about 500. And the health team and the government here went out, all out, and got the best part of 2,000. So we more than quadrupled our capacity in the ICUs. We also had health within the hospitals, and I'm sure it would have been happening here as well. But staff who were working in other areas were also asked to back in by learning how to work in an ICU. And the net result of that was that we're well placed if it does increase. But at the moment, it's very early days. So I think my advice to the community is be cautious, just the way you always have been, but don't anticipate necessarily a rapid growth. But let's just go cautiously and certainly listen to the continuing health messages of being cautious, and particularly if you have symptoms, go and get tested. I know in some situations that doesn't appear to have always happened. Clinton, sorry, you've got that hand out looking like you want to ask something.
I was going to ask the Premier.
Okay.
Once you finished, Mr.
Oh.
He's doing well.
Premier, this is certainly one for you as well. It's 337 odd cases today. It's the highest number. I know it's not a high number. It's the highest in 40 odd days.
COVID,
COVID
yeah.
cases. Are you still going to lift restrictions on the 15th?
Look, I think the answer is that we've always tried in New South Wales to strike the balance between the issues of making sure people are safe from the virus, and that involved, as I said, getting our hospitals ready. But to have a modest increase in the numbers is not particularly concerning at this point to me, because it hasn't seen a big increase of numbers in our hospitals. So we still only have, I think at Clinton today, the ICUs across New South Wales is 25 patients. So it's a very modest number, and a relatively modest number still in our hospitals. So we have capacity, and I think one of the issues that we've always done was work with Dr. Chant and her public health team, so the epidemiological team, about what they would like, and then work with the mental health team and the broader health team about what they would like. Look at the economics of it as well, and consider that the economics generally mean if people have a freer life and they're out there doing what they used to do, they've got jobs, they're making money, and their mental health tends to be better. And obviously kids at school, we know that a lot of them have been suffering. So I think we've got to strike a gentle balance here and not go scaring anybody unduly. And I'd ask the media not to do that either, actually.
We can do that.
No.
Premier, regarding the masks, Premier,
He'd like to answer something else too. I don't know.
are we still on track to remove the masks on the 15th?
Yeah, we've set the roadmap out, and we have obviously those restrictions finishing on December 15. We've stuck to that date. Now, if circumstances change, we'll always look at that. We've said that from the outset. Our key priority is keeping people right across our state safe. The Health Minister is completely correct. Just looking at those numbers at around 300, well, we would have expected, I think, those numbers to be much higher in circumstances where we opened up our state. So I think what is most important, continue to ask the media to do, is focus more, as the Health Minister has said, on hospitalisations and ICU presentations. That they are the numbers that matter. Case numbers in and themselves are only one measurement, and we are opening up. As we do open up, mobility will increase, and the fact that people right across our state have gone out and been vaccinated is the number one protection, which keeps them safe and their families safe. So, as the Health Minister has said, we're always going to have a balanced and proportionate response. Case numbers will increase as we open up, whether that's up to December 15 and beyond. But the success here hasn't just been on the health staff who've done an amazing job, but also on the efforts that every single person right across our state has made to go out and be vaccinated. That's been the success. We lead the country when it comes to our vaccination rate, and importantly, arguably, the world.
Last question, Joe. Omicron is still being treated differently. That family from Chatswood is in special health accommodation.
Yeah.
Will that student and close contacts be treated the same way?
Well, we're working through that. I mean, what we've asked for, and we've kept that quarantine in place for those families who have come in, or those people who have come in from overseas, from those 8 Southern African nations. Wasn't I? Now I understand it's 8. And that's a precautionary measure, and we know that takes effort and sacrifice, but we think in the coming days, weeks, we will get a greater understanding. As the Health Minister has said, early indications are positive. So we'll always move our settings around where we can, that it provides the greatest freedom as possible, but at the same time, what we've done here in relation to those people flying in from overseas, we've kept that in place, but we'll revisit that as we work through it. We've also have our health teams working very closely with the Commonwealth health teams to share that information, get a greater understanding, and also with the Victorians, because obviously New South Wales and Victoria are in a very similar situation.
So will that family be put? The student be put in special health accommodation?
The story with the people coming in from overseas is they generally don't have any accommodation. So they do go into the special health accommodation. And the current people who we're talking about, the families, I haven't got the up-to-date situation, but they're not automatically going to go into a quarantine arrangement, because it's quite possible they could self-isolate at home. So it's not a great concern either way if they need to go in there. Of course, we have capacity in the SHAR, the special health accommodation, sits around about 650, and we've got around about 250 still in a couple of the remaining police managed hotels. So if we need to, the opportunity is there, but we generally do it by consultation and discussion, not by directing. So if they need to go, we'll make that offer.
Premier, just finally, HSC wrapping up today, a big day, but reflecting upon the year, is there anything that you perhaps would have done differently? It's obviously been a hell of a year for this cohort.
Oh look, it's been a hell of a year for them. This HSC year and the last HSC year, those students have made enormous sacrifices. I wish them all the very best. Look, there are always things that governments could do better, but ultimately our focus has always been to keep those students safe and to keep schools open. And there's no doubt that it's the Year 12 students, the HSC year, that have led the way, made more sacrifices than most. I want to thank them for everything they've done, and I want to wish them well for a bright future.
Thanks everybody, thank you.